Hey, so I want to talk to you today about the sacro-iliac joint. The sacro-iliac joint is a joint that makes up the back of the pelvis, so one on the left and one on the right, and then in the center, you've got the symphysis pubis. But the idea behind the sacro-iliac joints is they are supposed to move in harmony with one another to absorb torsion, torque that's on the lumbar spine. While they're very mobile, they can go out in about 4 different planes. If they're out in one plane, it's uncomfortable. If it's out in 2 planes, it hurts. If it's out in 3, you're not really walking. The 4th plane is one where it kind of flattens, and it's the one that I want to show you how to combat today. The flattening of one side, you won't really feel it. It won't register as pain, but what it does is it makes the other side have to make up for its movement. Now, that ends up causing a lot of people to focus on this side because it's always going out of place, or it's always painful, always sore, when really this side has to be brought up to speed in order to move both of them. So the stretches that I have people do for these are really quite easy. One is gonna be really simple, you've probably seen it before, and it's gonna address the spine itself. The spine is at the heart of all of this. That's what the SI responds to. If there's some inflammation there or there's some misalignment, the SI joint's kind of like a circuit breaker. The thing is almost as big as your hand and it never really goes bad, but when it's out, it feels like it's gone bad. So the first is just going to be to stretch the lumbar spine, twist back and forth gently. And then the second, I'm going to show you guys how to fix one side, SI, while you rotate the other, and then gap the other. And then fix, rotate, and gap. Rotate and gap. So super simple. Very first, you're gonna put your legs like a tent, back, flat on the floor. Legs travel left, or in this case, right? And then legs travel to the opposite side. Now, if you don't get this far, don't worry about how far you get. It's the process of doing it, not how far you get, which is the product. If you're really good at this, advanced, you can start to bring a leg out further. Now we're going to address specifically the SI joints. First, you want to put bottom leg straight, which is going to fix the SI and the pelvis on one side, and then you want to bring knee towards shoulder, and then knee towards opposite shoulder. So knee towards shoulder, everybody does. That's the one that's going to rotate the SI. But then towards opposite shoulder is going to gap it. Fix the left or right side, knee towards shoulder, knee towards opposite shoulder with gapping. Knee towards shoulder, knee towards opposite shoulder. And that's basically it. Those done over time. And as you may know, I'm also an advocate of either using a topical or possibly a little ice pack there every once in a while to reduce deep inflammation. But those done over time will probably do more to keep your SI stable than just about any other exercise. If I had to recommend one more thing that's going to help over the long term, it's getting good at just a very simple, very deep squat and back up. Just a simple air squat. It doesn't have to be anything complicated or with weight or a lunge. Just a simple, deep squat, hold, and back up.